Welcome back to San Antonio Living. This morning, Dr. Hamilton is joining us with Excellent Periodontist. It's good to see you. We're talking about how not taking care of your mouth could really affect your body and the way you lead your life. And this is very interesting because I had never heard of this. You know, I tell my kids all the time, brush your teeth or your teeth can fall out. Now I can threaten them with a whole lot more.
Oh, exactly. And that's what we found recently is that the Surgeon General of the United States of America just announced a new initiative of awareness between the connection of oral diseases and the major organs of the body. You know, San Antonio has a silent epidemic of diabetes and heart disease. And one of the main contributing factors to both those is uncontrolled periodontal disease or gum disease.
That is shocking to me. How does that work? I mean, I know gum disease, you know, it's the overall bacteria that's in your mouth. How does that lead to problems like heart disease? Oh,
what happens is that the gum disease in your mouth actually infiltrates your blood system, and as it goes through the heart valves are very susceptible to any kind of bacteria, and the heart valves actually get overgrown with the periodontal bacteria, or they get covered with inflammatory products from the gum disease.
Wow.
Yeah.
And you guys are also hearing that gum disease can also create low birth weight for babies?
Right, and that's another problem we have in San Antonio. We have the record premature low birth weight babies, and the gum disease puts a huge stress on the body at the worst time possible during your pregnancy, and that results in a premature low birth weight baby, which causes them to be behind often for the rest of their lives.
Whole life. And it's something that you can take care of right now.
Absolutely.
It's totally preventable.
Right, because we can't change your genetics that make you predisposed to diabetes. We can't change your genetics to make you predisposed to heart disease. But this is one of the things that we can do to decrease your chance of heart disease, to decrease the effect of diabetes on your body.
Okay, so how do we prevent gum disease? What's step number one?
It's still the same old thing. I mean, you've got to go see your dentist on a regular basis.
Okay.
And San Antonio is blessed with incredible dentists, and you see them, they'll check you for gum disease, they'll start you on a personal home care program if you don't have it to make sure you don't get it, and then they'll also, if you do have it, they can start you on a treatment program to bring you back to health.
Okay.
And not just oral health, but the health for your whole body.
It's all connected, right?
Absolutely.
Mouth, body, everything's connected. Right. How often should you see your dentist for a cleaning?
Well, it depends on your conditions, with a minimum of twice a year.
Okay.
But if you have periodontal disease, it's every 3 to 4 months, because all the research shows that the bacteria become pathogenic. In other words, able to cause disease if left undisturbed for 45 to 90 days.
Okay. What about gingivitis? How does that contribute to gum disease?
Gingivitis is like the early stage or one of the most obvious areas of gum disease. That means you have a little bleeding in the gums are red. I mean, you check yourself when you smile in the mirror. Or if you floss your teeth and the gums bleed, then that means you need to go see your dentist ASAP.
Okay. And then the next step is periodontitis. How do you say that big word?
Periodontitis or periodontal disease.
Okay.
Yeah, and 75% of the adults over 35 have some degree or some of the characteristics of periodontitis. So, and that's when the bacteria is actually getting into the connective tissue or the fibers of the gum and into the bone. And that's when we really start to worry.
A lot of people sort of neglect their teeth, right? Because, if they look okay, you brush them all the time, you think everything's good to go. But if you're not seeing a dentist, you don't know.
Absolutely. And it's such a slow process that you don't have any symptoms till it's really too late.
Right. And this is definitely something that you have to check out, because you can really just put this problem to bed by, prevention early on. Whether you've got children or you're an adult, you need to make sure you see your dentist on a regular basis.
Absolutely. Absolutely.
Symptoms for gum disease that we should look out for?
Well, like I said, the main one is your gums are bleeding when you floss or brush, tenderness, swelling. Sometimes gum disease, actually the pressure of the disease actually starts to move the teeth, any new gaps occurring. Those are a bad breath odor is a huge contributing factor to gum disease.
Well, guys, if you have any of these symptoms and you're looking for a dentist in town who can take care of you, contact Dr. Hamilton. He's got several locations in San Antonio and New Braunfels. You can go to excellentperiodontist.com or call the number on your screen for more information. It's 496-5603. Again, 496-5603.